Good morning, Singapore. Welcome to the biggest and best breakfast show in the world. The reason why I'm saying in the world... Oh, by the way, good morning, Jerry. Dr. Geraldine time.
Good morning. In the world? Please share.
In the world.
Yes.
Because there are people listening to us from all over the world. And at this point in time, Shalini just told me, we have someone listening to us from Central America right now, Belize, actually.
Yeah.
Ruby! Good morning, Ruby.
From Belize.
Yes.
Wow, amazing. Good morning, Ruby.
Good morning, Ruby. Thank you so much for tuning in to us. Okay, so we have award-winning psychologist from the therapy room, Dr. Geraldine Tan, with us this morning. Good morning, Jerry.
Good morning.
Good morning, Jerry. You're so bright and chirpy for a topic that isn't.
Oh, I didn't do my
okay.
research. I have no idea what we're talking about today.
Sadness and depression.
Sadness and
Sadness
depression.
Yeah,
versus
sadness
depression. I think a lot of people don't know the differences, quite honestly. They get into a really bad, sad state.
And they say they're depressed.
They think they're depressed.
What does Jerry think?
If clinical disorder, it has to follow the big book of checklists.
Okay, so what is sadness versus depression then?
Okay, so let's look at depression first, right? So depression is a little bit easier to kind of diagnose. So you have that whole diagnostic manual that we have, and it writes there if you have a major depressive symptom. Oh, okay, before we go into that, there are so many different kinds of depression. Did you know that?
No?
No?
There is major depressive disorder, there's persistent depressive disorder, which is dysthymia, there is cyclothymia, there is depressive disorders due to medical conditions, there is premenstrual depressive disorders, PMDD.
But
So many.
are these all clumped under clinical depression?
Yes. So they are under clinical depression. They are called clinical disorders. So under clinical they are depressive disorders.
I had no idea about the premenstrual depression. What is that? Is that literally... Oh, okay, let's play a
Okay,
song.
I tell you what. We'll continue this conversation on the Big Show TV, okay? In the meantime, one of my favorite songs of all time. Here are the New Radicals with a track called You Get What You Give on 1FM.
Okay, so Jerry, we were talking about what? Clinical depression or clinical disorders? So, is there depression and then clinical depression, or are all depressions clinical?
So if you talk about depression as a medical condition, they're all clinical. But people tend to use the word very loosely, very freely. So it becomes, I'm depressed, oh, I have depression. But they actually follow quite a strict criteria. So if you have like major depressive disorder, then you would need to have it for at least 2 weeks.
Okay.
Okay.
So what can one say if they're actually very sad, but they're loosely using the term I'm depressed? What should they say instead? I'm sad. I'm upset.
I feel depressed.
Oh, I feel depressed.
It is a descriptor, right? I feel depressed, but it doesn't mean that you have depression, which many people then jump to, where our teens love to Google and then they look at all the signs and symptoms and say, aha, I have depression. And they start identifying with all the different disorders, but they probably are just stressed. They're probably, just having a little bit of a dip in the mood.
Okay. You know what? I say if you don't want people to think you're suffering from depression, then maybe don't even say I'm depressed. Then say I'm very, very sad. What do you
I
think,
feel
Jerry?
depressed,
Because when people hear you say I'm depressed, they automatically will assume that you are suffering from depression.
I don't think so. I think people when they hear you say I'm depressed, they just hear you say I'm really, really, really sad.
Then why don't we just say I'm really, really, really sad?
I think, correct me if I'm wrong, Jerry.
You're wrong.
People
No, kidding.
Your name is Jerry.
I'm just making the joke.
Do people tend to see sadness as a loss of something, but I'm depressed because I don't have control?
Okay, now I'm confused.
So you're right, for and to highlight that, because when they are in depression, they feel like they cannot control any and everything. So there's that element there. But when you're sad is an emotion, and sad is a normal emotion, and we should have sadness. Okay, so for those that say I don't feel sad at all, then I'll be very, very worried for you, because it is in our whole emotional repertoire, our toolbox as a human being. So, being sad over something, most of the time it is loss. Okay, so, but it also may feel, or you might think that you might not have some control over something. Right, there is a negative thought that comes together with it. I'm not sure why Glenn did this, but
He just took a selfie.
I have so
while
many
you were
friends
talking.
tuned in and all that, and they're daring me to take a selfie while
Live
we're
on
live on the
Facebook
Big Show TV. I'm like, what?
Sure.
This is
What is-
simple.
that's not a dare.
Yeah, exactly.
Give us a challenge.
So easy.
Give Glenn a challenge.
Jerry, Sue Cheng on our Facebook page asks, does sadness or depression have anything to do with your hormone levels? Can your hormone levels affect it?
so that's a really good question. That's why I purposefully said, PMDD, or premenstrual dysphoric disorder, which comes under the depressive disorder. So again, this, in order for it to be diagnosed, it needs to last for a year, and for most of your, if not all, your menstrual cycles, where there is a lot of like altercations before your menses. So we know that it coincides with your hormonal cycle. And there is like physical changes. There's also the signs and symptoms of depression.
On the flip side, you talk about PMDD, but then you also may go through depression during menopause, right?
Yes, so that is also another hormonal induced situation. Yeah, so that can come under, it's not premenstrual anymore. It can come under the depressive disorders that come together with a medical condition. So many people don't realize that sometimes post-surgery, you can fall into depression also. So post a medical condition, you might fall into that space of negativity. Somewhat like what FD said, there is a loss of something, but also that you can't control your situation.
So when you say post-medical, it could be like during recovery where you're bedridden and you can't do anything for yourself and you can't get out of bed, you can't go to the loo and all that.
Correct. So we see that very commonly with those that have lost, the use of at least a limb, perhaps, or they have like limited mobility, and they need people to help them with the showering, with the cleaning, with the food. So they feel very useless and helpless, and they spiral into some sort of a depressed state, which can lead to depression.
So when we talk about this, the other thing that pops into my mind is postnatal depression.
Yes. So there is postnatal depression also. And it is a state that they cannot control, right? And postnatal depression is when you already have the child. But there are those that we know have given birth to stillborn, have miscarried, and can fall into a depressed state, which doesn't quite fall under PND, postnatal depression.
Can men have depression because of hormonal issues?
They can. So we often tease the guys with the erratic testosterone syndrome, right? But more than that, they also, I mean, all of us have hormones, so
Yeah.
it doesn't mean that one gender is exempted from
But it's the
it.
testosterone. That's the problem, you see. Like for some guys, they have too much testosterone, right? And, maybe they've got a really high sex drive or whatever, but they're not having enough sex. So they go into depression.
Was that possible?
Yeah, that's interesting. Can they get
Well,
depressed that way?
From not having
Not
enough
having
sex?
enough sex.
She didn't catch, whatever.
High testosterone.
Low
not-
sex. Okay, hang
Not
on.
getting enough.
Yeah.
Traffic.
Okay, we'll
Oh, okay.
deal with this when we get back.
Really? You want to talk about
Let's
this on
talk
the
about
radio?
sex,
Okay.
baby.
Here we go. So earlier on, FD was asking the question, if a guy has a high sex drive and doesn't, get enough,
Can that lead to depression?
can that lead to depression?
I think it's a very real question.
FD
Yes,
was asking
well
the
done, FD.
question. Yeah,
Yeah.
yes.
Glenn
I
brought
was
it up,
trying
but
to-
I asked the question.
I was I was trying to think how to answer this question, right? Can they have depression because they don't have enough sex? Well, they can feel depressed. Okay, it might not be a clinical depression. No, but I was just thinking because what triggered me or triggered my thoughts was another aspect. So, erectile dysfunction. So, some men have that.
Oh, that confirmed depressed. Clinically depressed. I'm not even joking when I say this,
Yeah.
right? I mean, there is no way if a guy suffers from erectile
Erectile.
dysfunction is going to be a happy guy. You know what I mean? So that one
Sorry
is
for
like,
laughing.
it's quite obvious. It's
It's-
boom, depression straight away. Okay, but what I'm talking about here is what FD was talking about here is that if a guy has a really high sex drive, right, and somehow is not
Getting enough.
getting enough, not getting enough, could this lead to depression?
I don't think that it will lead to a clinical depression, but he will be sexually frustrated. He will be upset, definitely.
So he'll be more angry than anything else.
He may be angry, or he may feel like a failure, or he might feel, it might lead to other sort of feelings and thoughts, but may not lead to a clinical disorder. I mean, it may, but it may not be the only issue.
Right.
How do we as lay people know the difference between sadness and depression? How can we tell?
Okay, so we have that checklist, right? So rule of thumb, anything more than 2 weeks and you see the person in a very depressed state, cannot sleep, or sleep too much, eating wise, they eat too much or they don't eat at all. You see the moodiness of it, so you see it being prolonged. So we go, okay, maybe we should bring you to see someone, okay? Worse if they tell you, I don't know why I'm feeling so sad. And then if you see them not able to function at all. Now, I'm saying this, but that would be majority of them that cannot function at all, cannot go to school, cannot go to work, can't even do their daily tasks. That would be quite bad already. So if they can't do their daily tasks, that's already quite bad. Some of them can't even wash their face or brush their teeth.
So what would we do if a highly depressed individual, if that situation becomes critical? What should we do? Things like suicidal thoughts or even attempted suicide situations.
So in cases that are suicide risk, don't wait anymore, bring them to the doctor. Right? So if you cannot manage to bring them to like a psychiatrist, bring them to the GP first. The GP will then try and encourage them to go to the psychiatrist. The important thing for situations like that is to keep them safe first, because we don't know whether they are going to carry out But here's a little trivia. Sometimes when they're really, really, really low in energy, they might feel suicidal or have suicidal ideation, but most of them would say that I've no energy to carry it out. So when we see them getting a little bit better, that's the critical part, because now they have energy, they can carry it out if the
Oh.
suicidal
my
thoughts
gosh.
go there.
Okay.
Yes.
Okay,
So
Jerry,
we've
let's
lost.
yeah. Let's continue to talk about this on the Big Show TV. In the meantime, here's Billy Ocean. Get out of
So you've gone from like really critical, and then you've brought them up to that sort of midsection where it's still critical,
coming
but
up.
they have more energy now, which in turn gives them the opportunity to then carry out a suicide attempt. So how do you pull them up even further, into a better space?
So at any point in time, we want to keep our eyes on them. We want to make sure that we are not callous in terms of neglecting their needs. But it's very, very difficult. Oftentimes we go, yay, they're getting better, and then we might not pay much attention because the caregiver is already very exhausted, which is true. Right? Because when they are really, really, really low, there's a lot of energy trying to get them up, get them to do things, take their medication, staying up with them. So by the time they are a little bit better, the caregiver can get quite tired out. But that's also the very critical part. So, that's why the whole community comes in, the social resources. So we look at the different resources coming in.
So when is it safe to take your eye off them then?
We will monitor, so they would be able to tell us when the thoughts start to decrease.
All right.
Yeah, when they
So-
feel a little bit better. Yeah, so typically, those that are not planning it, or really very determined to kill themselves, they would be quite open in telling us that, yes, the thoughts have come down. It's a little bit less intense. It's less frequent. But the plan might still be there, so that would be dangerous.
Yeah. I have to say, there was a time where I was depressed for a prolonged period. I think I was probably depressed for about maybe 1.5 years
Oh,
Wow.
when I was in secondary school.
why?
Because at that time, right, I was going to the gym a lot. I was working out. I was taking all these supplements and all that. And I had an acne breakout
Oh,
during that time. Yeah. So, I know it may seem like I'm joking, right?
trivial, yeah.
But and I don't know whether you've had patients like this, Jerry, but I didn't even want to leave the house. It was, I didn't want to go to school. I didn't want to go out because I felt like I was so ugly, right? Because I had acne.
I can totally feel for
but
you.
isn't that something that most teenagers go through? Because all of us went through an ugly phase in our life.
I am so glad Glenn and Angel brought that up, because during this period of time, in fact, throughout my career, I see a lot of teenagers, right? And one of the issues is it a clinical issue or is it a teenage issue? And we know that the teen years, and we are talking about years, do last for that period of time. And, is it do we then diagnose as persistent depressive disorder, or do we just accord it to it's just being a teen? So that is really difficult even for us when we sit with the teen to try and figure out. Yeah, but no, but a very, very bad habit of mine to say but. So when we sit with a teen, right, to determine that, we need to really speak with them, really need to find out. So for Glenn, there was a very specific reason for you to do that. Another thing could be eczema. So the hormone part of things come into play during the adolescent stage. They are moody, they are irritable, they don't know their purpose in life. It is very, very dark, or they feel like that period of time is really, really dark.
Poor kids. I wish I could hug them all,
Right.
No, but I can totally understand where Glenn is coming from, because there he is. He's in the gym. He's trying to build himself up.
Yeah.
He's got this whole image of who he wants
Trying
to
to
be.
be a chick magnet here.
Yeah, and then suddenly he breaks out. That is like, oh my God.
But then I go to church, I see all these girls. I know exactly which girls I want to go out with and all that, right? And I'm thinking like, okay, if I go and approach them right now,
all they'll see
they're
are your zits.
Exactly,
Yes.
you see.
Yes.
Jerry, we've got so many questions on our Facebook page. One of them is this from Matthew. How do we differentiate between a natural, habitual pessimist and someone who has depression? Low energy, he says, can be due to many reasons. Some people are just more comfortable not being all joy and happiness.
So pessimism, then we do need to look at the personality. So if you see this person as, or someone is very pessimistic, then you would want to ask yourself whether this person has always been very similar. So, they would be similar as a kid, everything is just, it won't go well, it'll just go poorly. And it is across many years without getting their functioning or limiting their functioning. So they are still very functional, they are still able to do things, and they are not limited at all.
Okay. Another question coming through, and these very interesting questions. I'm not going to mention this person's name. You want to find out, you go to our
Why
Facebook.
just mention? Everyone can
Okay.
see.
Who is it?
Damien.
Okay.
Why did you mention his name?
Shut up, please. Quick question for Dr. G. What if a person has suicidal thoughts, but is too afraid to go through with it? He says, my personal experience.
Okay, and the question is?
What do you say to someone like that? They have suicidal thoughts, but they're too afraid to go through with it. But they're still thinking of killing themselves.
Yeah. So this category of people feel very even ashamed, like I'm even useless in carrying out this task that I set for myself. So there's a lot of disappointment and anger within the self. Now, if you do have that, then speak with someone, because it is not just the suicidal thoughts. There may be other areas that you might feel incompetent, insecure, and you want to build up your self-esteem and your confidence in your abilities.
Are there any comorbidities that commonly come along with depression?
Yeah, so besides depression itself, we have the other clinical disorders that can come together with it. It can be like anxiety, it can be like the eating disorders that we spoke about before, the post-traumatic stress disorder that we had also covered before. So many different clinical disorders can also come together with depression also. Even drug abuse, substance abuse, yes.
But I think anxiety is one of the worst, no? Okay, so that's another period where I experienced, I think, depression and, extreme sadness when COVID first hit.
Oh, really?
And all of a sudden, we had to work from home, and there were so many things happening. I was anxious because because at that time, I just felt like if I were to get COVID, I'm dead. This is before vaccination, and we didn't know what COVID was about and all that. And there was all these stories and news of people around the world dying. In Italy, it hit them so badly.
Yeah, it did, yeah.
And then in India and all that. And I was thinking, oh my God. And every day I would just think about that and start to feel anxious for my family members and all that. and thinking to myself, hey, I could be gone in a few days from now if I get this. And I got very, very anxious, and I felt very, very sad. And all of a sudden, everything, I just started being very, very negative about everything, very pessimistic. I couldn't see the future at
Cynical,
that
yeah.
point. I'm like, is this the world? Is this what the world is going to be from now on,
Yeah.
So I did slip into a depression for I think maybe a month or two or more. I think I just didn't show it, right, but
Yeah.
deep down inside I was feeling this this heaviness in my chest, this sadness, this fear.
I think you're just saying what pretty much the entire world went through, because I mean you come from a position of privilege in the fact that you have clean water, a roof
Yeah.
over your head, a job, and everything else. But a lot of other people in the world didn't have all that, and they lost a lot of stuff, and they lost their own lives or their kids and stuff like that. So
Yeah.
it's really something that everyone was thinking about. When is this going to end?
Yeah.
Because at first, when it first came, we thought, okay, it's another SARS thing. It's gonna go in like a month, and then it never did, and then it's gonna go in 3 months, 6 months, 2 years later. We're still living with restrictions
Exactly.
and people getting sick. So I think you're just voicing out what a lot of other people did go through. But
Yeah.
I think we came out on the other end quite lucky.
Okay, stand by. We're going for a traffic break, and then we'll.
One of the questions that's come through on our Facebook page, Jerry, goes back to the topic of hormones and whether or not they cause depression. It's from Margaret. She says, post-mastectomy cancer patients on long-term hormone therapy, can this be depressive? Because this therapy goes on for very long periods.
You should get the medical doctor to come in and talk about the
Yeah, okay.
hormones. But in truth, yes. So it brings about the mastectomy surgery does bring a lot of different emotions for the woman itself, not just the medication part of things. So if I veer away from the chemical part
Yeah.
of things, just the emotional part of things already is very trying, because you have to then relook at yourself. You need to redefine what a woman is. You need to also reconcile with the fact that yes, you're recovered, but you've lost something. So how do you deal with this loss? Yeah, so a lot of questions come in, and also that fear, right? Whether it's going to recur or not now that you've taken such a drastic measure, because nothing is 100% also. So all these are swimming in your head and is accompanying you. At some point, will you be able to continue to regulate your emotions or not?
I mean, we've been talking about so many areas that could lead to sadness and depression, but we haven't touched on death.
Grief, yeah.
Grief has led to many people
Yes.
feeling depressed for prolonged periods. Could be years even. Some people don't get over the death of a loved one. Now, how common is this, Jerry?
So grief by itself is a state that you are in, right? So let's look at sadness. So all the different emotions pushes us to do something about our situation. So it includes sadness. So sadness pushes us to do something. So grief is also being in that very sad state. So what are we going to do about it? We can write a letter to our loved ones. So it pushes us to do something, in memory of, or to flip back the photo album, or to talk about them. So it is not bad. It is just an emotion that reminds us to do something about it. But we might not be depressed or in a depression disorder. So we might not have a depression disorder.
But you said just now, if it's prolonged sadness for more than 2 weeks, it's depression. Did you say
But
that
there
earlier
is
on?
Yes, I did. But it is more than that one condition. There are a few conditions that you need to fulfill to then fulfill the criteria of being of having a depressive disorder.
Okay. I've got a friend whose mom passed away like 6 years ago. He still says he's depressed every day. He thinks
He
about her
can
and
feel
his.
Yes, yes. So he can feel sad. He can feel he can grieve and miss his mom, but he might not have depression. So his life still moves on. It still continues. He's not limited, or he's not it's not frozen in that
Yeah.
space.
Yeah, he says he feels her still, every day. And this is after 6 years. I don't know whether that's a good thing or a bad thing, you know what I mean? Because he can't seem to get, I mean,
But
it's
it's so-
horrible to say get over something, but
can't, yeah.
yeah, but it's affected his life. It's affected his marriage even,
But it's so hard to
Yeah.
know where someone's coming from because each person will go through it differently.
right?
Each person
Yeah,
handles it
it's
differently.
very, very
Imagine that,
hard.
I'm saying this because I believe that there are people out there,
Yeah.
Yes.
who have still not gotten over, the passing of a loved one.
And yeah.
So I mean, what advice do you have, for people like that, Jerry?
I mean, if you're saying that it has affected the marriage, it has affected his life, then sit with someone, sit with, a counselor, a psychologist, to talk to someone. He might not need medication, but just to process what are some of the unresolved issues that he might have with, that relationship, or, the loss of his mom.
Jerry, we've got a question or a statement from Fiona. And I just want a quick answer on it. She says, depression is well known to many, but there are those who look very happy-go-lucky on the outside, but are very depressed on the inside. Is that possible? Can you be depressed and yet nobody knows? You don't show it
Yeah.
at all?
Yep. So these are really dangerous and very, very hard to spot. It's very trending now with the young people. It's called smiling depression. Yeah. So they go around, they are able to do and function, and nobody knows about it. But when it, is quiet, they are alone, they're in tears, they are unable to function. They find it so difficult to even do their work or their homework. So it is possible. Yeah.
So I want to ask you more about that when we go on the Big Show TV.
All right. Okay. Here's Billy Joel right now, The River of Dreams.
Smiling depressive, all happy-go-lucky on the outside and all tears when the doors are closed. Then how do we help that individual, because we don't know that person is depressed? Does the person even know that they're depressed?
They actually do know, because they're so upset and frustrated. So many times, those with this sort of depression are able to come forward and look for help. Yeah, or it will get to a point where it's too difficult to contain anymore.
Radio DJs are very good for this.
What? Smiling depressives? Really?
Smiling depressive.
Remember? Same. 2019, at the start of COVID-19, my dad died,
Yeah.
and nobody knew.
Yeah.
I was on the air.
You think that was a contribution to your sadness during
Absolutely,
COVID?
absolutely. But
Yeah.
nobody knew.
Yeah.
I didn't tell
Because
anyone.
you're a
about it.
professional.
I just came on air. Nobody knew.
Yeah.
I think, even you didn't know.
No.
Right?
What
but
about-
I was
yeah.
so depressed.
Yeah.
I saw a psychiatrist
Oh, okay.
because I knew I would
You
have
needed
to
someone.
nip it in the butt.
Yeah.
Right, I had to do something, and of course I knew Jerry wouldn't see me, so I had to get somebody else.
Getting on her couch. No.
But hey, one session with that psychiatrist, he looked at me in my eyes and went like, "You'll be fine," and that was
it?
the first and the last session.
Wow, good for you. Good for you.
So Jerry, these smiling depressives, it's not denial. It's just that they don't want to show it.
And they find it very difficult, and they find that they don't want to burden other people, or they find that it is an embarrassing thing to showcase that depressiveness. Smiling depression is not a clinical diagnosis, okay? It is not in my big book of manual, but it is something that is floating out there. So if you Google it, you'll be able to find it. But it is not a clinical diagnosis. But we do know people who are struggling, similar to what Glenn has described, really struggling on their own, and nobody knows about it. And for some reason or other, so Glenn framed it as a very professional front, so he didn't want to let anyone know. Someone else could feel that it is embarrassing, or everyone have their own issues already. Why should I go and burden someone else with my micro issue? So they feel that their issue is not big. Everybody goes through it. Yeah.
So we were talking about grief earlier and how someone can fall into a depressive state from grief. Can that grief kill that person? Because we've heard of couples that have been together for years and years and years, and when one passes away, the other one becomes very depressed and then dies of a heartbreak, or that's what we say, but more often than not, maybe it's a heart attack or something like that. Can that cause death without an actual suicide attempt?
But it's a real condition, someone dying of a
Of-
broken
of
heart.
a broken
I've
heart,
spoken
yes,
to my
exactly.
cardiologist about
Yeah,
this.
so is that via depression into that broken heart?
It's a very acute situation, right? But mainly it is because they've lost the will to live. There's no more purpose. There's no more direction. There's no more joy that is left. So they give up. So for these couples that you're talking about, these old couples you're talking about, they literally just give up life. They don't give up the partner, they just give up on life. Because life was with the partner.
Yeah.
And now there's no more life. So they let everything go. So it is possible. And some of the older seniors that we see, how they give up is they just stop eating. They wouldn't eat at all. Yeah, so we know that they have already given up. So you can see that they've lost their eyes become very lifeless.
Yeah, that spark.
So it's important.
So
It's important
sad.
for everyone to take up something, a hobby, or do something that they love.
Yeah.
So even if it's watching Korean drama. my mom loves going for walks and watching Korean drama. She
Yeah.
loves that, right? Or TV or Netflix or whatever, right? And some people love like going out for dance classes. Some of our more elderly folk go for Tai Chi classes in the morning, and then they socialize with their friends. Or in the Whampoa area, I see men playing chess, or just watching their birds.
Yeah.
There are people who still. They keep birds,
Yeah,
and
yeah.
there are places where you can,
Or a pet or something.
or a pet. But it's
Yeah.
important to have something to look forward to.
Yeah.
Right, Jerry?
Yep. So I always talk about the 5 pillars, right? So physically keeping yourself or having something to do. So keeping yourself moving. Yeah. Intellectually, learning something or doing something exciting. I was just sharing with my dad what a client actually shared with me, a game called Nerdle instead of Wordle.
Wordle, yeah.
It's Nerdle,
I've heard of
which
that.
is math, equation, and it's so hard. I'm like, I cannot figure that one out. So
That will make me feel depressed.
I don't think we will feel depressed. It just feels quite stupid. Every time I look at it, I go, "Ooh, I cannot." Yeah, but that intellectually stimulates the person. You excite their brain. That's why there was even research on mahjong that helps to stimulate the brain. So that's intellectual stimulation. Social stimulation, where you have people around you, you go out with people, you have a good conversation. Spiritual health is also very important for some people. And it can be religion, it can be meditation, it can be doing something that is creative just for yourself. Yeah, and importantly, the emotional part to keep yourself happy. So all these 5 pillars to just look out for that.
Right.
Mm.
You know,
Okay.
living living a good life is actually an art. You
It
know
is
what?
an
Yeah.
art. It is
Right?
an art. It gets harder as you get older.
Yeah,
let me tell you.
we need to put in that effort
Yeah.
as well, and
Yeah.
be wise in in our choices and decisions.
Yeah.
Anyway, okay.
Very true.
Julian needs to come on.
I think so. Sorry. Yeah, lost track of time.
We always do.
All right. Any last words, Jerry?
Yes, so I just learned that silver plath is some of the books and some of the poetry is being studied as a literature material in schools. Silver plath herself had suffered from depression. She's an author. She suffered from depression for many, many years, and she killed herself when she was 30 years old. But she writes so beautifully. Yeah, it's quite tragic the way she dies, but it's so popular with the young people because she is that epitome of depression, brains, and then she kills herself. Please do not make her a heroine, but she writes beautifully. And she says, right, so I have 2 quotes from her. She says, "Let me live, love, and say it well in good sentences." And
Love that.
and a reminder for all of us who may have depression, because she says the silence depressed me. It wasn't the silence of silence, it was my own.
Wow.
And that's quoted from the Baja, one of the books that she's written. Yeah, so very powerful words that she's written. I wish that she had help. Maybe she had, I don't know.
Yeah.
But for those who are suffering, please, there is help out there.
Right. What's her name again?
Sylvia Plath.
Sylvia
Plath.
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 Okay. Gonna check her out. Okay. Thank you so much,
I'll
Jerry.
see you all next week.
All right. Have a
Bye.
wonderful day.
Bye, Jerry.
Bye,
You
Jerry.
too. Bye-bye.